started.
Hello to you. Just check if it started, Gauri. No problem. Hello to you. At the outset, I would want to wish all of you a very happy Diwali. Also, I think all of us together stand united with those who have lost their loved ones in these COVID times. For them, I wish to tell them that we are with you and we will do everything to take this COVID under control. The second thing I'd like to let you know is let us all attempt to stay safe. It is not so difficult. If we do respect the pointers that we have been learning over the past 8 to 9 months to safeguard ourselves from COVID, we will be able to achieve victory over this virus. What is it that mankind has not been able to achieve? So let us together pledge to stay safe. I wish to now start on the topic that I have come together with all of you to share, that is sudden cardiac death. At the outset, let us understand, why is it that we need to discuss this at all? We must not forget that while we are battling COVID, the problems, the chronic diseases that we have been living with have been around and we have not been able to counter them. In fact, they have been neglected. Hence, together, all of us together need to discuss why is it that we are talking on this subject. Some of you would be cricket buffs, must be aware that we certainly lost a cricketer by the name Dean Jones while he was in Mumbai, and he was absolutely fine. Then, to mention another person all of us are very well aware of, is APJ Abdul Kalam. Why is it that these people lost their lives? So you need to understand, is this problem common? Yes. Sudden cardiac death is something which happens commonly. To give you in numbers, 1 out of every 1,000 people in the world loses their life to sudden cardiac death every year, which makes it a common occurrence. Many of us would hear to situations such as, that person was fine and he did not wake up next morning. Sudden cardiac death is in our neighborhood. We all listen to this daily or at certain times in our lives. Sudden cardiac death is something which needs to be discussed because it is a disease, it is a problem which we can counter if we teach our. We must understand that it is common. We must also understand it is very heterogeneous. You should not think that sudden cardiac death will only happen to those people who are elderly. It can happen, it can affect people in the prime of their lives. For example, Dean Jones. Those of you who follow football will be aware that we lose footballers in the prime of their youth at 28 or 30 years of age to sudden cardiac death. So we have to understand as to why does this happen. People confuse sudden cardiac death with heart attacks. They're completely different. So what is a heart attack? You have to understand, heart attack is when one of the blood vessels of our heart blood supply gets clogged. The patient presents with sudden onset chest discomfort in the middle of the chest, radiating to his neck and to his shoulders. And that's what we call heart attack. Always when a patient has heart attack, we as medical professionals keep telling our patients, do not neglect, rush to a hospital. Why do we say that? We say that because we want to act quickly. We also say that because it is during this heart attack, our patients can have sudden cardiac death. We can lose our lives during a heart attack. Heart attack is a sudden clotting of a blood vessel. We must do everything to protect ourselves from heart attack when it is happening, because this clotting of a blood vessel can result in a sudden cardiac death. Second, supposing a patient has heart attack and he does not realize that he had a heart attack and he keeps living very well after that, we must understand after a heart attack, if our heart muscle becomes weaker, we continue to remain at risk of sudden cardiac death. So we have to understand very clearly that the commonest cause of sudden cardiac death is a clot of the blood vessel, which can be an acute situation such as a heart attack, as I told you. That's why we say that if you think that you are having any untoward symptoms such as pain in the jaw, pain in the chest, center of your chest, radiating to your shoulders, radiating to the inner side of your arms, especially the left side of the arm, or even presenting with something like nausea and vomiting, which you have never faced in the past, do not neglect. It's always better to seek medical attention and be proven that you don't have a problem rather than have a heart attack go unnoticed. We also must understand that this is a problem, sudden cardiac death, which actually we must not fear, and if we take control in our hands, we can protect ourselves from this devastating problem. We as general population, those of us who do not have any heart disease, should understand that we are all at risk of sudden cardiac death, and it is our duty to protect ourselves and our loved ones from this disorder, which is a common occurrence. Those of you who joined in late should understand that sudden cardiac death is common. 1 out of every 1,000 people in the world succumbs to sudden cardiac death every year. That means it is a very large number. If you want in exact numbers, 400,000 people per year in the United States succumb to sudden cardiac death. Now you can correlate that to India, which will be much larger. And it is not the duty of just few people to protect you. It is your own duty to protect yourself from this devastating problem called sudden cardiac death. So remember, if you are an adult, you are beyond 18 years of age, there are certain things that you must start early. Also, those of you who are in your mid-30s or mid-50s or mid-60s, it doesn't make a difference. You can start protecting yourself from this problem at any point in time, and it will prove worthy. What do you have to do? If you have no heart disease, what you need to do to protect yourself from sudden cardiac death is take control of your lifestyle. Most important pointer is having a very effective lifestyle. What does that imply? You must attempt to exercise at least 4 to 5 days a week. People often ask this question, how much do I exercise, doctor? A very easy rule is the rule of 4. 40 minutes, 4 days a week. 40 minutes, 4 days a week is a good rule. So you must attempt to take out at that much time for yourself to ensure that you follow an active lifestyle. Second, contain the salt in your life. Remember, all things white are not good for us. What are those all things white? Salt, sugar, maida, butter, rice and wheat. Now they're all things white. Let me reiterate, you don't have to stop them, but you must limit the intake of all things white in your life and begin to depend upon fresh fruits, fresh vegetables and nuts and pulses and legumes which are good for you. So if you want to protect yourself from lifestyle diseases, first, this is the most important thing that you need to do. Is a good lifestyle, 40 minutes of exercise, 4 days a week, followed by eliminating excess intake of salt, sugar, oil, maida, rice and wheat. Next comes those of us who already have high blood pressure. What do? Yes, the same thing. Refer back to point number 1. Good lifestyle and good diet intake along with taking your blood pressure pill. As doctors, the most common question we get from people who have high blood pressure is, Doctor, do I have to take a pill every day of my life? To which I reply that, well, now that high blood pressure has set in, it is best that you keep your blood pressure controlled rather than not taking your pill and having high peaks in your blood pressure and exposing yourself to the ills of high blood pressure. Remember, if you keep your blood pressure well controlled, there is a good chance that you will be able to protect yourself from the ills of the disease which will set in as you all age. So first point was a good lifestyle and diet. If you have high blood pressure, refer back to point number 1, must exercise and must contain the intake of all things white. It is not difficult. If you make an attempt, you will be able to do. Third, diabetes. First is try to halt the progression of your weight gain so as to protect yourself from diabetes. Remember, India is the diabetic capital. We all must ensure that we must eliminate the capital of diabetes from India. And it is between you, me and all of us that we can attempt to do so by referring back to point number 1. If you want to protect yourself from sudden cardiac death, remember you have to ensure a good lifestyle, make your blood pressure stays at bay, make control of your diabetes, keep your HbA1c much under control as directed by your doctor. And fourth, the most important is smoking. Those of you who smoke must ensure that you quit smoking. It is not something which cannot be done. If once you take it upon yourself, remember, smoking is something which you are harming yourself every cigarette you take. There are people who come and tell us, Doctor, I have been smoking for the past 20 years. Now if I quit, it will make no difference. Remember, medical science tells us if you've been smoking every day of your adult life for 20 years and if you quit it within 6 months, you will see that the effects are reversed. So any day of your life when you take a pledge that I will follow a good lifestyle, I will reduce the intake of salt and sugar, I will keep my blood pressure in control, I will get my diabetes under control, I will quit smoking. That is the day you walk on the path of reducing your risk of sudden cardiac death. Coming to the population of those of us who may have suffered some injury to the heart by either having a heart attack or your loved ones may have some disease in the blood vessels of the heart, may have undergone an angioplasty, they may have undergone a bypass surgery. But now what can I do to protect myself or my loved ones from the problem of sudden cardiac death? Yes, it is important we discuss that because they are at risk of sudden cardiac death. Refer back again. That cannot go unnoticed. A good lifestyle with elimination and reduction of high blood pressure, diabetes, smoking is the mainstay. But alongside those of us who have our loved ones in our lives who have already undergone an angioplasty or a bypass surgery or who have some disease in the blood vessels of the heart must remember to respect the doctor's prescription. Your doctor's prescription is something which you must follow and respect. Take your medications on time. They have a profound impact on protecting you from sudden cardiac death as well as your heart disease coming back. You must remember the medications which keep your blood cholesterol under control should be respected. Your medications which are called antiplatelets when asked by your doctor must be taken. Do not think that I don't need them now. Go back to your doctor and discuss with them, because if you wish to protect yourself from this disorder called sudden cardiac death, which is common, affecting one person out of 1,000 people on this planet Earth every year. Remember, it is common and it can affect any one of us. We all hear that. We must eliminate this disease and reduce it by respecting our doctor's prescription. After that, refer back to point number 1. Lifestyle is the mainstay which we must follow. Third point I want to bring is those of us who have our loved ones in our family who have had heart disease, and if are living with a reduced pumping of the heart, we must ensure that we go back to our doctors and discuss that, am I at risk of sudden death? Remember, the heart has a pump. The pumping action of the heart should be normally between 55 to 60%. On an echocardiogram, we call it the ejection fraction. If you or your loved one have an ejection fraction of the heart which is lesser than 40%, you must refer back to your cardiologist to discuss the risk of sudden cardiac death. If we as human beings have an ejection fraction of lesser than 40%, we are at a higher risk of sudden cardiac death. To protect ourselves from sudden cardiac death, if our pumping ability of the heart is poorer, we need to take control, we need to take our medications, and we may need some devices. We have extremely robust devices called as defibrillators. They are called implantable cardioverter defibrillators, which are implanted on the left side of the chest under the collarbone, and they are very robust, and in fact they are medical marvels. The defibrillators are reserved for those people who have poor pumping of the heart. Whenever the pumping ability of the heart is lesser than 35 to 40%, we begin to speak to our patients about the need of an implantable cardioverter defibrillator. It is a very small device, like a matchbox, even smaller than a matchbox. It sits under the collarbone and it has a wire which goes inside our heart and it monitors every heartbeat. It is like a very intelligent doctor sitting in your chest wall, or it is as if you have an emergency room inside your chest wall. So this is called an implantable defibrillator. The implantation procedure is very simple, but it should only be offered if the patient really needs, which your cardiologist must decide. So when you have or your loved one has a heart disease, it is imperative that you talk to your doctor about the pumping ability of your heart. If the pumping ability of the heart is less than 40%, you may need some devices, or your loved one may need some devices which are called implantable defibrillators. So I would like to conclude and give you a take-home message. Remember, sudden cardiac death is something which we listen to often. It is in our neighborhood. You would hear at some point in time that that person was absolutely fine in the night, but he never woke up in the morning. Or, I had dinner with him last night. Or, he was my friend, we played together yesterday. So that's what is called sudden cardiac death. It's a bolt out of the blue. It happens when we have any disease in the blood vessels of the heart. We may not know that we have disease in the blood vessels of the heart. So you must get yourself tested. And most important message is that all of us must pledge this Diwali that we will follow a healthy lifestyle by exercising at least 40 minutes a day, 4 times a week. We will limit the intake of salt, sugar and trans fats, maida, oils, ghee to our best. We will take control of our blood pressure. We will aim to keep our blood pressure less than 130 by 85 millimeters of mercury. We will take control of our diabetes. It is not difficult. Those of us who smoke will pledge not to smoke. So these are the factors which apply to each one of us as an adult. Those of us who already have heart disease should not be disheartened. We have very good medications to ensure a good life for us. Go back to your doctor, take your medications regularly, follow a healthy lifestyle. If your pumping ability is less than 40%, discuss with your cardiologist if you or your loved one need any device which is called an implantable defibrillator. Thus, friends, let us all pledge today to have a safer planet by taking good control of our lives as well as the lives of our loved ones. I wish you all the very best. Should you have any questions, please feel free to ask me and I will be happy to answer. Thank you so very much.